Hi guys, it's Amanda and welcome to another edition of Miss Amanda Speaks. Today I wanted to talk again about Turner syndrome and the diagnosis, the prognosis, the cognitive issues, and the reproductive issues that us Turner syndrome girls do encounter. I'm going to start with the diagnosis, how you would diagnose Turner syndrome. Turner syndrome may be diagnosed by an amniocentesis during pregnancy. Sometimes fetuses with Turner syndrome are identified by abnormal ultrasound findings, i.e. heart defect, kidney or abnormalities, cystic hemorrhage, although the reoccurrence risk is not increased. Genetic counseling is often recommended for families who have had a pregnancy or child with Turner syndrome. A test called a karyotype, or a chromosome analysis, analyzes the chromosomal composition of the individual. This is the test of choice to diagnose Turner syndrome. Now to move on to the prognosis. While most of the findings in Turner syndrome are harmless, which they mostly are, there can be significant medical problems associated with the syndrome, such as diabetes, horseshoe kidney, heart issues, which all of those are going to be separate videos for you guys. So I'm going to move on to the cognitive problems. Turner syndrome does not typically cause mental retardation or impair cognition. However, learning difficulties are common among women with Turner syndrome, particularly a specific difficulty in perceiving spatial relationships such as nonverbal learning disorder. This may also manifest itself as a difficulty with motor control or with mathematics. While it is non-correctable in most cases, it does not cause difficulty in daily living. The girls that I met that have TS, definitely we all have that in common, where we've had problems with math and stuff like that. There is also a rare variety of Turner syndrome known as ring X Turner syndrome, which has an approximate 60% association with mental retardation. This variety accounts for approximately 2 to 4% of all Turner syndrome cases. Now I'm going to move on to the reproductive problems and stuff like that. Women with Turner syndrome are almost universally infertile, while some women with Turner syndrome have successfully become pregnant and carried their pregnancies to term. This is very rare and is generally limited to those women whose karyotype are not 45X. Even when such pregnancies do occur, there is a higher than average risk of miscarriage or birth defects, including Turner syndrome or Down syndrome. Some women with Turner syndrome who are unable to conceive without medical intervention may be able to use IVF or other fertility treatments. Usually, estrogen replacement therapy is used just for the growth of secondary sexual characteristics at the time when puberty should onset. That means that helps us have our period. It helps us have the hormones we need to mature. If you've ever seen a Turner's girl, they look younger than they really are, and that's why. But anyway, that's what I'm going to share with you guys today. Again, that was the diagnosis, prognosis, cognitive, and reproductive issues and stuff. I got my information from Wikipedia. I did pull it from a few different sources, but I decided to use it from Wikipedia. If you guys have any questions, feel free to email me at missaminaspeaks@yahoo.com, or feel free to email me on YouTube. Don't forget to check out my Facebook fan page, facebook.com/missaminaspeaks. If you guys have any questions, I'll be more than happy to help you. I hope you guys have a blessed day.